All right. Well, good day, everyone, and welcome to our third webinar in the 4-webinar series about RBA. Today, we're focusing on performance accountability. How do you develop performance measures and do turn the curve thinking with performance measures for continuous improvement to come up with action steps for improvement? But as always, we're going to start by jumping to Mentimeter. So let's jump to Mentimeter. And let's see who's around the table today so we can kind of get started. So put your name, your role, and how are you feeling today? All right, well, let's go on with a couple quiz questions here. Is anyone better off is the most important performance measure? True or false? Okay, let's see what you think. Yeah, most of you got that correct. That is true. The most important performance measure is anyone better off, because that one is directly related to telling you whether you're achieving the goal or purpose of your program or your activity or your strategy. So that one is the most important one. Is anyone better off? All right, which strategy action selection criteria is correct? We talked about this during the first webinar and a little bit on the second. So leverage specificity, feasibility, and values, leverage proxy, feasibility and values, or leverage fund, feasibility and values. Okay, let's see what you think. All right, 50-50, but the first one is correct. Leverage specificity, feasibility, and values. Leverage proxy is related to selecting headline indicators or performance measures, not selecting actions or strategies. All right. And trend lines have two parts, a history and a forecast. True or false? Trend lines have two parts, a history and a forecast. All right, see what you think. That is true. Absolutely, that is true. So great job, everyone. So as I said, today we're going to focus on developing and selecting performance measures. And as you remember, performance accountability is about the programs and services strategies that you implement, and the performance measures is the data that tells you how well you're doing in relation to your programs and strategies, and it's focused on the people in your programs, not population accountability. And then this is the performance measurement matrix that you remember from the first webinar, where it starts in the upper left-hand quadrant with quantity and effort. How much did we do? Which tells us how productive we are. Doesn't tell you anything about whether the program's working or not, but you need it for budgeting and planning. And if you've been funded to serve 500 people, you want to make sure you fund or serve 500 people. So that's, again, number of people, activities. Upper right-hand quadrant, how well did we do it? Quality and effort, customer satisfaction, retention rates following our protocols. And that tells us whether we're doing things right or not. But the most important performance measures are, is anyone better off? Because that tells us, are we doing the right things? Because you could be doing things right, but not the right things. Just a quick example, when I was with the United Way in Tucson, we had an agency that was working to help young children read. And they had this great strategy of handing out bookmarks to kids, and they were really good at it. They could hand out 1,000 bookmarks to kids each quarter, which was wonderful. So they were doing things right. Unfortunately, they shouldn't have just been handing out bookmarks. They should have been handing out books. So that was kind of doing the things right, but not the right things, because to teach kids to read, they all need books to do that. But again, the most important is anyone better off, because everything you do is designed to change skill, knowledge, attitude, opinion, behavior, circumstance, or condition. Those are all measurable through observations, evaluations, pre and post tests, surveys. You can find out if what you're doing is working. So that's the most important one, and the one you should develop first when you're developing performance measures. So I just wanted to show you some examples again of performance measures around how much did we do, number of students, this is around education, number of students, number of days of instruction, number of parent-teacher conferences, how well did we do it, student-teacher ratio, percent of faculty certified in the subject they teach, percent of buildings without major maintenance repairs, percent of parents involved in schools, average expenditure per student, average daily attendance or reimbursement, attendance reimbursement as a percent of total. So again, those are examples of how much and how well, but the most important one, directly tied to education, percent of reading scores at above grade level, percent of math scores at or above grade level, percent with good attendance, percent of students in extracurricular activities, the graduation rate, and ninth graders who graduated 4 years later, on time, 4 years later, and percent of graduates in school or jobs, 1 to 5 years after graduation, and the percent of placement in jobs related to training. So again, the key around performance measures, typically they start with a number, percent, dollar amount, ratio, and they're just about the data. They shouldn't include the data. They should just be about the data, and they shouldn't include the target, because the target you can change over time. Here's child welfare. How much did we do? Number of foster children served, number of child abuse investigations, number of adoption recruitment sessions. Again, how productive we are, how busy we are, how well did we do it? Caseload to worker ratio, percent of foster children placed in their original neighborhood and school catchment area, average number of changed foster care placements, percent of investigations initiated within 24 hours. And again, the goal or purpose, so is anyone better off measures, number of percent of foster children in stable permanent living arrangements after 6 months of care, following up to see how they're doing. Percent number of repeat abuse neglect cases, percent number of foster children with good school attendance, percent number of foster children reading at grade level, and the rate of adoption stable after 6 months. So those are examples of performance measures. And again, as we've talked about before, less is more. So you don't have to develop a whole lot of performance measures. You just identify what we call the headline performance measures, the most critical ones that will give you the data that you can use to improve. So what we're going to do as we start out, we're going to break into your 2 breakout rooms again. And if any of you are here for the first time, we'll assign you to a breakout room, but we're basically going to assign you to the same rooms that most of you are in during the last session. And I'm going to ask you to pick one of your strategies from the last exercise, and I'll show you those in a minute, and develop some performance measures around them. How much, how well, and better off. And then you'll have a chance to present them, and we'll discuss them. So again, using this, and we're going to use this document right here, where you can put in list the name of your program or your strategy, who are your customers, what is the goal or purpose of the program or strategy, and then jump right down and figure out how we're going to know we've achieved the goal or purpose of our program. And then you can go up and do the quantity and the quality. How much did we do? And is anyone better off? And if you have too many performance measures, remember we did this with the indicators last time, you can rank them on these criteria of communication power. Do people understand it? Does it make sense? Does it communicate to a broad range of audiences? Proxy power or importance power, does it say something of central importance about your program? And does it bring along the data heard? Again, if you've got 3 or 4 measures, you don't need all of them. Just find the one, because they're probably, if they're related, are going to be tracking the same way, either up or down. So you just need to find the lead horse in the herd, the one that has the most communication and proxy power, communication and data power, quality data available on a timely basis. So we have another document like this where you can just list all of your performance measures and then rank them to come up with your headline. Again, 4 to 6 performance measures that truly tell you what you need to do. So what we're going to do, let me go into the OneDrive first. So here is I'm going to put this in the chat, this link. Make a copy that link. And then what you're going to do when you get in this folder is you're going to hit the webinar breakout documents right here. Click that. And here are the ones we're going to use today. First one is 4.1 for group 1. right here, which has the document, and 4.2 for the other group. And then here at 5 is the one for selecting your headline performance measures. And again, breakout 1 and breakout 2. Right there, and this is where you can copy those in and then rate them on communication, proxy, and data power. High is 3, medium is 2, low is 1. To help you do that, and then what you can select is your headline performance measures, as well as ones that might be in what we call your data development agenda. You might develop a performance measure that you really like because it has high communication power, high proxy power, but you don't have the data. So you need to put a committee together, potentially, or create a data development agenda, put a committee together to come up with a way to collect that. It may be a survey, maybe some kind of an evaluation tool that you need so that you can select that data. But because we've got a small group, let's go ahead and have a little practice run right now. So somebody put in the chat one of your programs. What's one of your programs you'd like to develop performance measures for? What is, just name kind of in the chat one of your programs, and we'll do one together first. Okay, minority health initiatives. Okay, can do that. Okay, so minority health initiatives. Who are your customers for your program? And what is the goal or purpose of the program? Easier to do the goal first. So again, why are you doing the minority health initiative? What are you trying to change? What is the goal of the initiatives? Again, ends to means planning. You have to be crystal clear about why we're doing something. We don't just do it because somebody said do it. We have to know why we're doing it. The expected outcome, the result of our program. Okay, decrease minority health disparities. All right. And who are the customers? Who are the people that are going to be in your programs to decrease health disparities and increase health equity for minorities? All right, so who are the customers? Who's going to be served by your program? Copy, because again, this is a program, so we're not looking at changing these overall at the population level data. This is program level data, so racial and ethnic minorities. So how would we know now the better off measure down here? If our goal is to decrease health disparities and increase health equity for minorities, how would we know that for the people we serve in our program? Yeah, okay, Anita, I assumed you guys were going to go with that your customer is actually not. That's why I'm glad we went down this road. But in this case, your customer is actually the local health departments. If you're doing the initiative and is funneled through the local health departments, is for them to do that in their service communities, then your customer, and this is a good way to think about this. So we want to back up a little bit. So that in this case, if you're the overall state health department, your customer is the local health departments. And this is kind of truly a strategy. And your goal is for them to improve health equity and disparities in their communities that they serve. The goal for the local health departments to improve health equity and reduce disparities in their service communities. So that is the goal, is health equity and disparities in their service communities. So in that case, this measure would be the number and percent of local health departments who decrease their disparities, because that's what you're trying to do, is help them decrease their disparities. So it'd be the number percent of those local health departments who decrease their disparities and increase their health equity. Basically, you could look at the number whose health equity curves are now improving, is what you're looking to do with this initiative. And this is very similar to the perinatal equity initiative that the California Department of Public Health is doing, that I talked about in the first webinar. So now up here, how much did we do? what would be your performance measure for how much did we do? This would be the number of local health departments contacted. And then over here, you could do the percent of local health departments elected to join the program, because I assume they have to agree to do it. Or you could do the percent of local health served, but you have number of contacted, because you got to contact X number, and then see those contacted agreed to do it. And here you could also track the number of local health departments that enrolled in the program, something like that. And then, okay, you've got the number of health departments served. Yeah, we've got that. And then the number of ethnic and minority population served, that would be by each department. And that could either be here, or it could be in how much did we, or how well we do it. But this number of ethnic and minority served by the local health departments. And what you would want to do is track the individual ones, and can aggregate that up then in the scorecard to see how many collectively are serving ethnic and minority populations. So that's a quick example of, again, and this is a good way to think about it. And we're going to talk more about this at our next webinar too, about developing performance measures to help you implement strategies. So again, for example, how many local health departments are there in Nebraska? Okay, 19-ish. Okay, so again, what you would want to do is see, okay, how many were contacted? Did we contact all of them? Did they all agree to serve or get involved? But how many or percent are now? Because if you find out you contacted all 19-ish, but only 10 did it, then you'd want to figure out why. So you could get more of the local health departments to actually do this. So that's another.
Dan,
yeah, go ahead.
Can I say something on that? I think for our office, the issue hasn't been so much that the local health departments are not part of it. It's more that they really haven't been doing the last bullet, which is really up above number of ethnic minority populations served. That's where it's the biggest thing, is we pretty much have them all, but I mean, only the ones that they have to have a certain minority population to actually do the, to get the funds.
Right.
So even though we have 19, we may not have all of them contacted, because they may not all have the minority population needed to qualify for the funding. But the biggest issue, from my perspective, and my teammates can chime in, those who have more experience than I do, is that the number of ethnic and minority populations served by the local health departments is one of our biggest stumbling blocks, is them being able to actually engage and get relationships formed with the minority communities that they work with, so that we're actually seeing real change versus lack of a better word, not.
No, that all makes sense. But the important thing is you'd have to have that data disaggregated by the local health departments, so that, because you can't just do one shoe fit or one size fits all, you've got to look at their individual, what they're doing. You can aggregate up that data to see how your initiative is doing overall. But the data as to the number of ethnic and minority population served by the local has to be at the local level, so that you can see that, so you can see what one has to do versus the other. There may be different things, different issues, why they're not serving the number of people. But this is, I think, a good start at beginning to help you develop your data. So thank you for that, Anita. But again, you can see that performance measures are fairly simple the way you describe them, because it's just the data you're going to collect. You add the targets later, and that's why it's important to highlight what you did, Anita, that it's maybe 19-ish, but only 15 of them meet the criteria. then your target would be not all 19, your target would be 15. Those are the ones, the 15 that are meet the criteria, and then you would see how you're doing to get all of those 15 actually in the program and doing things. So it gives you a good way to begin to look at this. And as I said, we'll talk a little more next webinar about implementing these kinds of performance measures, which are really about strategy implementation. But what I wanted to show you, going back here, for each of the groups, group 1 and group 2, you did your turn the curve exercise. So I want to make this a little fun. So the igloo group gets to still talk about the igloos. So Alex, I know you're ready for that. So what you're going to do is pick one of your strategies you developed, either the free biennial inspections or the festival once a year, including tours of stock igloos. So you got to figure out what are the goal purpose of either of these, which is who are the customers and your performance measures. So you guys are going to pick one of these, and the other group, group 2, you're going to pick one of yours. And again, either create a community advocacy group to address policy change or conduct a food community needs assessment. So you'll pick one of those and develop your performance measures. So any questions before we start the 2 breakout rooms? And then 4.1 and 4.2 are the ones you're going to use. Looks like folks are already there and ready to get started. So I'll give you about 20 minutes to do this, and let me create the 2 breakout rooms. All right, welcome back, everyone. Welcome back. Like you had some good discussions. So what group would like to present yours first? Group 1 or group 2? Igloos or food? All right, I guess Alex is ready. All right.
Always.
All right, go for it.
That's true. So we went with the free biennial inspections. So that's an inspection once every 2 years, not twice a year, until corrected otherwise. Customers are just the Brambergonians, as they're called. Obviously, compliance with igloo building and safety standards per city codes. So how much do we do? A lot of our stuff was built on like advertising and building our capacity to do the tasks. So we wanted more people to know about it. So that included more flyers, more clinics that are out there, and community hubs contacted. And then we also needed more inspectors to be certified and recertified to handle the hopefully influx of people coming in and getting their inspections. How well do we do that was judged by the number of free inspections performed. I guess that'd be based probably on a 2-year basis. And then that is also including the percentage of the igloo homes inspections performed. So yeah, which leads to just anyone being better off.
For is anyone better off? We talked about the percentage increase of igloos that are now up to code from the period that it started to the next period that we're measuring. A decrease in soggy homes, which is what results when they aren't up to code. And then the percentage of people that are happy with their homes and the percentage of people with a positive outlook on future of their igloo home.
Okay. All right. Well, thank you for that. I think those are some good performance measures. Just a couple thoughts about those is that the increased compliance with the igloo building and safety standards is the goal. So if we think about that down here, then really the increase of igloos up to code is absolutely the perfect one, and decrease in soggy homes. But happy and outlook are probably more how well did we do it measures than better off, because that's not in the goal. We want to increase compliance, not that we wanted people happy with their homes. That's certainly, well, you could change your goal. Although, again, that's be helpful data to have, because that probably does lead to more folks getting the inspections that they need to get. And so we don't really have to argue whether it's a how well or better off, but those two might not be headline measures just because they're not directly tied to the goal or purpose. And so I think we've got some good ones around that as you move forward. So good job. And then I noticed that you all did start to at least get yours in here. So what I thought we would do right now is just as a group, kind of just kind of score a couple of these just to give you a sense of how this can be helpful. So if we were looking at number of flyers posted of free inspections, again, communication power, is that a 3, 2, or a 1? What do you all think?
Probably high because it's just flyers posted out in the community. So it's very
probably
broad.
a 3. Yep. And then proxy power, does this say something of central importance about your program? And I would say yes, because that's, you're trying to get more inspections created. And data power, you can probably count that fairly easily, right?
Mm-hmm.
So that has potential.
So that would just be, we literally would count the number of flyers that we are putting up. That's how that you would.
Yep, that's how you
interpret
get
that.
that. Yep. And number of clinics held. Again, that's probably, again, folks get that. And that's going to be helpful to have folks understand it. And it's easy to track the clinics. And same for community hubs contacted, although you might have to better define what community hubs are, unless that is a term that's used in the community. And so I think that, so again, you can see how this would play out. Most of these are pretty easy. Most of these would be pretty high. But one of the things we said while you were away is that the percent of people with happy homes and percent of people with positive outlook, those are probably not of central importance to what you're trying to do, because they're not in part of the goal, which is to increase compliance. So those might be a little lower, and so they may not be headline performance measures, but they may be just secondary ones that you would use if you find out things around satisfaction. So you're building your ability to develop performance measures, I think. So that's awesome. And again, the other thing, you started them all with the number percent. And I really recommend folks do as you did, which is use the percent sign, a dollar amount, because that just reinforces that they're data. And that's a good way to do that. All right, so now let's go to group 2, food insecurity rate in Nebraska. Tell us about yours.
I guess I'll do that one. So talk about, first starting off looking at our program and deciding on what the goal and what we want to achieve. So I think our focus was the needs assessment, looking at the recommendations, identifying how we'll conduct a needs assessment. So when we look at the needs assessment, we, overall identified consumers of, the grocery store for the needs assessment to be overall customers. And our goals was to use the needs assessment to identify the barriers that, people have with accessing healthy foods. So a few of the measures we identified, how much do you do? Of course, measuring the neighborhoods on how many is being reached out, measuring the zip codes that are being affected population-wise, and measuring the barriers that are identified and being addressed so that we can understand what's going on. And how well that we do it will be based on surveys completed to gather that information, and it pretty much surveys. So yeah, that's kind of what we have.
And then is anyone better off?
Anyone better off? We identified 2. Of course, the barriers addressed. It's the needs assessment needs to be able to identify those barriers. And then the second one would be satisfaction rate. So I guess after the grocery store is developed, based on the information, how many people are better off in terms of satisfaction, given what they need.
All right. Well, thank you. Just kind of you're kind of combining a couple things, and there's a simpler way to think about this, just to help you out. So the first one, so the program is in food insecurity rate in Nebraska, and you've highlighted your customers are consumers. So you mean your customers are the people in the community that purchase or have to access food, not the stores, not the grocery stores or the food providers, but your customers are the consumers. Is that correct?
Right.
Okay, and the goal is to identify the barriers on accessible, healthy foods, right? So what you're trying to do in this, the needs assessment, is to identify the barriers. Doesn't say anything about addressing the barriers or reducing the barriers. That wasn't the goal. The goal of this program is just to identify these 5, 6, 7, 10 barriers. Then you're going to develop new programs to reduce those barriers or eliminate those barriers. This is just the needs assessment itself. So that's not about addressing the barriers. This is only about identifying the barriers, because that's the goal, to identify the barriers on accessible, healthy foods. You didn't say to identify and address, you just said to identify. So I would, and I think that's perfectly all right, because you want to first identify them, then you're going to have a variety of different programs. And depending on what the barriers are, different staff, different people would be involved in the different barriers, because it might be transportation barriers. So you're going to connect with transportation resources. It might be cost to be doing it a different way. So I think what I'm trying to highlight is you can really simplify these things and don't try to do too much with this one program. And then and I assume what you mean here, because again, it doesn't start with a number sign, doesn't start with a percent sign, so it's not very clear. That's why if you did this exercise with this initiative, you put those there, you would realize that the communication power of some of those is not very high. And that's why that tool is helpful. So again, I assume what you mean by this is the number of neighborhoods contacted?
Yes.
Okay, so this would just be the number of neighborhoods targeted, maybe?
Yes.
Okay, cool. And you could also do the number of zip codes targeted.
Number of barriers identified.
Yeah. And actually, no, what this would be now, this would be the number of consumers surveyed.
Mhm.
So this would be this number of surveys, number of consumers surveyed, or how do you plan to do the survey? How are you doing the surveys? Is it knocking on doors? Is it sending them emails? Is it putting it on your website? How are you thinking of doing the surveys?
Now that you think about it, I don't think we got that deep. So probably a combination of, a few things.
Because what you want to look at is the number of consumers, for example. I'll just put it this way: provided the surveys, and then over here, then you could do the percent. Here you would do the percent of surveys completed, because what you want to identify is if there is any dropout and what percent dropout on that. So if number of consumers provided the survey, and then you can also here can do actually you probably do the number and percent of surveys completed. So if you provided 100 surveys and 50 were completed, then that would be 50, which would be 50%. And then you would have to decide, is that target good enough? Did that give you good enough penetration to get your survey done? So, and then how many were surveyed were merchants? Again, if you're targeting just consumers, that wouldn't become an issue. But if you did want to track that, if there's ways that the merchants could get the surveys, then you would do, again, probably the number of percent surveyed were merchants. Is this making sense, what I'm suggesting?
Yes.
And then because, again, the goal down here is to identify the barriers on accessible. This is just is actually just the number of barriers identified is really all you need down here for this one, because that's the goal of the program, was to identify barriers. So we identified 6, 10, whatever that number is. Then you can develop programs to address each one of those barriers.
Wonderful.
So was that helpful?
Yes, indeed.
Okay, I think I kind of simplified it a little bit.
Sure did.
All right. Well, the next thing we're going to do is we're going to do again, as we did before with the indicators. Now we're going to do the turn the curve exercise. accountability around performance measures, selecting action steps for continuous improvement. So again, we're going to do the same thing in the OneDrive. And this time we're going to use the similar document that we used at the last one, which I'll show you in a minute. But just remind you that when we're doing turn the curve thinking, whether it's for indicators or performance measures, basically the same 5 questions. The only difference is when you're doing it with performance measures, that's to come up with action steps that staff, volunteers, partners could actually do to improve your program, because you're typically tracking performance measures during the year. Quarterly is the best time frame to do it. So you're not spending too much time collecting data, and you have time to look at the data, see where we are, do a turn the curve exercise, and then come up with ways to improve over the next 30, 60, 90 days. Look at the data again and see if you turn the curve. And so to do that, you still have to look at what's the story behind the curve, what are the factors pushing up, pushing down on that trend, who are your partners that have a role to play, because we can't do it alone. Remember in the exercise we did on the first webinar where we talked about, okay, we want to offer childcare. Okay, who's going to offer the childcare? Our staff isn't going to do it. We need an agency organization that's going to do the childcare to help improve our program so that more women can stay in the breastfeeding program, because we now offer childcare. But one of our staff has to take the role to make sure that happens. So our staff person or a team of our staff is going to go and contact various entities to find an agency to offer the childcare. So it's, again, we're always still looking at partners, and then what works, brainstorming all the things you could do to improve what you're doing. Again, to get more women to stay in the program, all the things we brainstormed what to do. And then finally, what is your action plan? And then now it's a specific action plan around how to do that. So you, again, always brainstorm the negative and positive factors, pushing up, pushing down on the trend line. And the facilitator should ask at least 5 times, what else could it be? Always address, are there any factors causing disparities? It's great if you can disaggregate the data by race, ethnicity, gender, age. Makes it easier to potentially see the disparities, but you don't have to do that because you've got people around the table that are knowledgeable about what you're doing and your program, and then you can't work on all of them. So you prioritize the top 3, 4, 5 factors to work on, and then who are your partners? Again, focusing on the partners, and always be specific with names, not just sectors. So not just, we need to get local government involved, but what city, what county? Want to get businesses involved, what business? Not just sectors, the business community, because then you'd have to have a whole nother meeting to figure out who to call. And then what works? And now we're looking again for evidence-based, promising practices, low-cost, no-cost ideas, off-the-wall ideas, because it's brainstorming. But what you want to do is really think about actions that staff could take, things you can do to improve the way your program is. So you don't have to just say, oh, well, they're not showing up, or, oh, well, it's not working. How can we change it so it is more effective? So if they're not getting the inspections, how do we need to change it? What do we need to do? So we do get the number of inspections we want, because you're always setting targets around your performance measures. And if it's not on target, what are you doing to improve? And the action plan should be specific with by do what, by whom, by when, so that you're very clear. Action plan, we're going to do this. Who's on staff is going to be responsible, could be 1 or more. But you can't just say our agency or some other agency, because then it won't happen. You got to assign people to actually be responsible to complete things, and then set the date. And by when, you have to put actual date in there, not just next week or next month, but by when, so that we can look at the accountability. And then when prioritizing strategies and actions, you can use this criteria again of leverage, feasibility, specificity, and values. Leverage, do we think it'll actually make a difference? It's worth doing. Feasibility, it's something we can actually do, because we don't have legal authority for it, or it'll cost too much money. We can't do it right now, so you don't do it. Specificity, it's specific enough we know what to do, and does it align with the values of our organization, our community, and is it further equity? Because we don't want to do anything that would have a negative impact on equity. And again, we have this document in that you can use to rank them and then rate them on those criteria if you need a little help in selecting the ones you're going to do. Sometimes when you do this, particularly with performance measures, it's clear enough. Okay, we need to change the time of the meeting. That's pretty clear. We don't have to use this, but if you do have a number of them and it's not as clear, this can help you do that. And then this is the form that you're going to use, similar to the last one. So let me jump into OneDrive now. And now you're going to use 6.1 and 6.2. And what I want you to do is pick one of your performance measures, just one of your performance measures, and assume that it's not achieving your target. And so again, same thing, put the one performance measure. Is the trend going up or down? Is that good or bad? And then again, just assume that it is not on track to achieve your target, whether your target is below it or above it, depending on whether up is good or bad. And then brainstorm the factors and just list the factors pushing down on the trend line, or the negative factors, the factors pushing down, pushing up, and positive, negative factors causing disparities, just as you did before. What are the top three priority factors you want to work on? And again, you just copy and paste them down here. Then who are your partners? And then what works? What kind of changes? And again, some of these may not be applicable when you're doing a performance measure turn the curve thinking. It's just what are the action steps we as staff could take? So you can list them in any of these criteria. But you do want to look at community engagement, low cost, no cost ideas. What can we do without money, just acting differently, and any off the wall ideas, and then come up with your action plan. So again, pick just one of your performance measures, assume it's not achieving your target, and come up with an action plan to improve it. And I'll give you about 20 minutes again. All right, welcome back, everyone. Looks like y'all had some good discussions. So let's, Alex, let's keep it going. Let's hear from your group.
Yeah. Where to start? Probably at the top. So obviously we're looking at igloo inspections, and then our performance measures. Percentage of igloos up to code is what we are going to be looking at. Trend is currently going down, and that is not good. The things that are affecting that trend line are timely inspections, successful advertising, the cost to igloo owners, and then the level of like community support or engagement, and like that, like peer pressure thing to like get it done within the community, you know. It's like when your neighbors put their lights up super early for like the holidays, and you're like, is it time? No. Let's see. So pushing it down is unsuccessful advertising, which just is not reaching enough people. Lack of knowledge of specific inspections. So maybe a lot of people just don't know that this inspection needs to happen. Fear of the failing the inspection. And then just the amount of people that are just kind of migrating into this town. So like related to the lack of knowledge for it, but just increasing the denominator instead of like decreasing the numerator there, causing the disparities. So a local builders coalition has been building igloos long before the code was improved, and feels like they can build better without the codes. Certain occupations might not get advertisements due to them, like how they might work overnight, or they might work further out away from big community goings-ons. Inspections are mostly done in certain parts of the town just due to infrastructure of the town and maybe some biases of the inspectors. Certain minority groups don't get inspections due to the timing of the inspections and the location or proximity to inspectors hub. And then just general, there's just trust issues between inspectors and some igloo owners. So from that, we took lack of knowledge of specific inspection. Inspections are mostly done in certain parts of towns. And then the Builders Coalition has been building without codes for many years. partners here, we want to include the inspectors, current and potential, the neighborhood community leaders, or like our HOA kind of like presidents or so, like that level of kind of leadership. Igloo Owners Association, that's like your HOA, but IOA. And then the Igloo Builders Coalition, as mentioned earlier. So things to turn the curve, we're going to certify more inspectors within certain low rate communities. So trying to make more representation amongst the inspectors as kind of an evidence-based. We think we should be promising is expanding the inspections out to 7 days a week. Public policies, we could increase property taxes on non-compliant igloos. So that should get some people moving on getting their free inspection. Community engagement, a lot of outreach to the coalition, the IOA, and then the neighborhood leaders. Low cost door-to-door inspectors for the elderly community members. And then off the walls, we're going to melt some QR codes into some of the exterior walls of non-compliant igloos so that they can scan the QR code and get their inspection scheduled. And then inspectors are hosting block parties. Everyone on the street or on the block comes out and hangs out, gets to know the inspector. The inspector inspects their igloos, and we're good to go. And then we got to 2 actions, training more inspectors by the city appointed instructors, and then building a focus group that encompasses the Igloo Coalition, the Igloo Owners Association, and other opinionated folk. And that'll be put on by the inspectors of glacial living and of glacial, what was it? It's gone. And overseers of safety.
All right. Awesome. Well, great job. And I think you really did a nice job of using kind of a fun exercise to just focus on learning the process. So I think that worked for you guys. What do you think? Rather than jumping right into your programs. Did you have fun with it?
I think it was good. Yeah.
Okay.
They take it too seriously, obviously.
Yeah, but you learned the process, and it was clear you. Somebody said asked at least 5 times. What else could it be? So that's how you get to rise in the population, which might not be one that you would get initially. So I think you did a great job, and also because again, what you did with the priority factors is you copied and pasted from the ones that are up here. You didn't move to solutions already. You just highlighted your 3 of these that you could now work on. And then who are your partners that could help you work on lack of knowledge? Inspections are mostly done in certain parts, and the doing it without codes in the past or inspections in the past. And then who are your partners? Fairly specific. And then you came up with action steps potentially to improve and get more folks, things you could do to get more igloos inspected. And again, you highlighted that we need more inspectors. So train more inspectors, got that. What I don't see up here is the focus group, because again, just as up here, when you pull from these to prioritize, here you should basically pull from your ideas here to put them down here. So is the focus group kind of highlighted anywhere? Am I just missing it?
No, it was something that came out in the actions step.
Okay.
And we then ran out of time and we're like, we'll let Dan figure out the action steps at this point.
Okay, got it. Yeah, I knew you weren't quite done, but the other group was done. So I wanted to move on because I think you did enough of the good work. But again, and so what you can do, that'll often happen. People will say, hey, well, how about a focus group? You can also add that back up here. So there is, people can see the clear kind of continuum from the top to the bottom. The only thing I would highlight, again, the by whom's, really you need to have a person's name there, somebody that's responsible for taking the lead. So if you're going to train more inspectors, somebody that's going to tell the city appointed instructors they need to do it. So you always want to make sure you're not just saying the city appointed instructors will do that, because then nobody has accountability. If you say they all will, then nobody will potentially. So you always want to make sure and build the focus group. That would be whoever the president is, or the whatever of the Igloos Society, that you would actually ask them to do that. Okay, so
We all know.
Yeah, all right. So you get what I mean, just so that you can send him or her an email letting them know we assigned you this, or you were around the table doing it, more importantly, because you don't want to assign things to people that aren't involved in the group either. So good job. And I think you're well on your way to doing turn the curve thinking and identifying performance measures and helping implement your real work, which we'll talk about next Monday when we meet again. But great job. Well, now let's talk about group 2 and food insecurity rate in Nebraska program. Tell us about your turn the curve exercise.
We thought the factors were going up based on good responses from the neighborhoods that were designated for the surveys. And we did provide the surveys in multiple formats, so it was easier for everyone to complete, whether it's by paper or online or by email or something else. What didn't work well was we didn't get all or the correct data that was needed. There were language issues because of some of the minority communities spoke other than English. And there was a reading literacy level that needed to be addressed. So we needed to simplify language so everybody could understand it easier. Some of the barriers that we did find was that it was transportation to get food. I don't know if that belongs there now, but the length of the survey was too long, and the distance to the stores and shopping was a barrier. And the top 3 factors was that we should have rewritten the questions to get better data or more complete data. We did find out after the fact that the time frames for the surveys was not great. There was a lot of competing time for families and people who did the shopping. And we need to evaluate what platform works best for conducting the survey. And for partners, we did identify several, but not specifically enough. We thought local health clinics, the extension centers, SNAP programs, food pantries, and summer school programs would be good sources to distribute information through. As far as evidence-based practices, we could increase the amount of advertising flyers, use social and the news media to promote individuals taking the survey so we get more information. We could also include flyers in the grocery stores, perhaps in the grocery bags or in the carts. Maybe have the mayor make a public announcement on the need for easier access to healthier food. We also thought lunch and learns with our partners as a group event to help highlight the need for easier and better access to healthy food at the community level. Low cost or no cost idea would be maybe distributing paper versions of the surveys at key locations where people would be shopping, just to find out what works and what doesn't work for them. And then meeting with the local government officials to see what the plans are for zoning issues for grocery stores and such. And the off-the-wall idea were potential gift card giveaways when you do complete a survey, or perhaps a fruit basket, since we're trying to promote healthy eating. And we did not complete the very last portion there.
Right. Yep. All right. So a couple thoughts to help you here as we go through this, but good job beginning to think of things and think about the factors. So again, it looks like based on your comments here is that this performance measure is not the right performance measure. Actually, it sounds like, because you're talking about response rates. So isn't the performance rather really the number of surveys completed? because the neighborhood's targeted and reached out to, these things don't respond to that. So is it actually number of neighborhoods targeted and reached out, or the number of surveys completed?
It should be the number of surveys completed.
Yeah, okay. So if that's the case, then that makes sense. Then the factors pushing up, good. Okay, from some desert neighborhoods, we did get good results. And using the multiple formats got that, potentially got some better surveys. Factors pushing down, again, what inadequate data received, that's the issue. It's not a factor. The factor is maybe language accessibility, literacy issues, and then the literacy issues would actually be one of the factors causing disparities. And well, maybe the length, distance, whatever. And then again, what you're supposed to do here, you jump to solutions here, rewrite questions, time frame for better surveys are completed, evaluate what platform is working better. Those are all solutions that belong down here. What you, again, just as the other group did, what you should do here is just pick which of these do you want to come up with action steps to improve. So for example, what you would highlight here is length of the survey, put that down here. And then one of your solutions would be rewrite the questions to get better data because the survey is too long. So again, what you want to do is see a flow here. You brainstorm all of the factors pushing up, pushing down, the negative, positive factors creating disparities. And then you identify which of these do you want to work on to develop action steps and partners to address. So again, this might be, again, length of the survey, time frame for when the surveys are completed. Again, that you might have to add that up here and evaluate platform. And again, that would be what you might highlight here is multiple formats for the survey. So this would be using multiple formats would actually be down here instead of evaluate the platform. That would be down here in the actions you can take. And then here are your partners. The only thing I would highlight again, be specific, what local health clinics, what food pantries, unless there's only one, and what schools are you going to engage? And then again, looking at increased amount of advertising and flyers, good idea. News, social media, flyer and grocery bags. These are all, again, potentially good action steps you could take to increase the number of people submitting your surveys, including certainly different ways of doing it, different, again, paper version and off the wall ideas. And then you would take these ideas that you came up with. And so, for example, let's say you wanted to do gift cards, you want to do incentives. For you decide, yeah, we want to do incentives for people that complete the survey and advertise that. Then down here you would put, create, offer incentives, and who's going to do that? One of the groups on the group is going to do that. So Ashley's going to do that, and then you'd ask Ashley, when can you get? You're going to go talk to Target, other grocery stores to get gift cards if they fill out the survey. And then you could ask Ashley, when's she going to have that done? And she'll say August 15th. And now you begin to have an action plan. Then you can look up here and say, who else is willing to do any of these? Who's willing to develop the flyers, put in the grocery stores? So we can identify that one. Flyers in the grocery store. And let's see, somebody else in the group. I think Erica was in the group. Did I get that right? And then Eric is going to do that by X date. And so that's how you can use this. And she's going to do that by July 31st. All right. So now you've got a turn the curve exercise that's actually a little easier to drive. Now you have an action plan so that we're going to offer incentives. Ashley's going to come back. Okay, I've got gift cards for everybody that completes the survey. And Erica can say, okay, here are the flyers. Now we're going to reach out to the departments or the grocery stores. So now you have a plan that you can see the clear flow from the issue. Not enough surveys are being completed. Why aren't they being completed? But you're not at zero. So good response from some neighborhoods. So you can identify what was unique about those neighborhoods. Maybe there were some champions there that were promoting it. That would tell you we need to identify more champions. So does that help kind of going through this? Does that make sense, group two?
Yeah, once you break it down that way, for sure, it seems like you had some stuff in the wrong place.
Mhm. That's what I was going to say. It was separating what is, what actions we need from the strategies, I guess.
Yeah. And that's why we do this exercise. That's why you do it in breakout rooms, is so you have an opportunity to do this exercise and do what works, and then find out, oh, ways you could do it better. So I think you're on a good stead. And the other thing you can do is in this OneDrive folder, just to remind you, let me go back to the link where you'll have, yeah, here it is here. RBA guide and the 2-pager have really good information to help you do the turn the curve exercise. So thank you all, but let's jump back to Menti again. Let's jump back to Menti and see how you're doing on your rating your knowledge of RBA. Again, we were, as you know, I think about 2 something. So how do you now rate your knowledge of RBA after our 3 webinars? Because we did an overview, we did population accountability, and now we've done performance accountability. Looks like we've definitely turned the curve. One person's almost ready to teach RBA to others. And a couple of you are kind of in the middle now. And one person just starting, and maybe somebody that just joined us and wasn't at the other webinars. So again, you'll have in the OneDrive folder that you'll have the link to, you'll have the videos from all of these webinars, you have the PowerPoint, you have the documents, so you can always refer back to those to learn. All right, so let's jump to the next one. What's one personal action commitment to expand your RBA knowledge? How could you help increase your RBA knowledge? What's one thing that each of you would commit to do to increase your knowledge and expand your knowledge of RBA? Yeah, practice as a group, absolutely. You can use those documents in the OneDrive folder. Work on examples in real life work, and we'll start doing that next week. But as you could see, I think it really helped the group 1 to kind of pick a fun activity to really focus on the framework and the process. So I think that does help. But now you want to apply it to your real work. Continue quizzing on results, indicators, programs, and performance measures. Yeah, we'll use the common language. Oh, and I had no idea igloos were your real work. Good job, Alex. I didn't know Nebraska got that cold.
It's a short-lived season,
Yes.
getting shorter by every year.
Yeah. Hey, understand more about items turning the curve. Yeah, again, so if you read the RBA guide, it walks you through, again, all of the key steps of turn the curve thinking. The other thing you can do, if you have access to the scorecard, show you this real quick. Remember the turn the curve exercise that we did around breastfeeding or attendance of the performance measure, this one. This opens up. If you do turn the curve thinking in the scorecard, you can click on this little question mark here. And here's a short video from Mark Friedman.
Once you have your baseline with history and forecast, then you can start to dig into the story behind the baseline. What are the causes and effect? What are the forces at work? Why does this picture look the way it does? Sometimes it's useful to organize that discussion in terms of what's working and what's not working, because this isn't all about what's not working. You want to take credit for the good things too. But it's also about digging deep and not settling for easy answers. I have a friend who says, ask why 5 times. Dig down as far as you can in causes, because every time you identify a cause of why things are happening the way that they are, that's going to be a pointer later in this process to actions that you can take to address that cause.
Okay, similar one for each one of these so that you can watch those as well to help you do that. Yeah, learn turn the curve. All right. How did today's webinar go for you? How did it go? And my data I use to improve my webinars. So how'd it go? Well, I want to thank you all for joining me today on your journey of increasing your RBA knowledge and strategy of using it. And as I said, we'll have, I think, a good webinar next Monday, really helping you implement RBA. Well, have a good rest of your week, and we'll see you next Monday.